The topic of our study was clinical and prognostic significance of aberrant T-cell marker expression in acute myeloid leukemia. We all know that flow cytometry-based immune phenotyping is a very important diagnostic tool in acute myeloid leukemia. The aberrant T-cell marker expression is well known and is seen in fraction of cases of patients with acute myeloid leukemia. The significance of aberrant T-cell marker expression not quite understood. The preclinical data showed that this group of patients may originate from T-cell precursors, and this group of patients is associated usually with poor response to induction treatment and poor prognosis. The goal of our study was to re-evaluate the clinical and prognostic significance of T-cell marker expression and association with disease-specific characteristics and outcome measures. In our study, it was a retrospective study. We re-evaluate the flow cytometry files. We reanalyze them, the files from 324 patients with acute myeloid leukemia who were treated with intensive chemotherapy at our center from 2011 to 2019. We analyzed following markers: CD2, CD4, CD7, and cytoplasmatic TdT. In our study, we defined for each marker the negative and positive lymphocyte population. The negative lymphocyte population we used and was defined as a negative internal control. The blast population was considered positive if it was located in the positive blast gate and was not overlapped with negative lymphocyte population. The cutoff of positivity was 20%, and our study was approved by our local ethics committee. In first part of our study, we analyzed the association of expression of T-cell markers with disease-specific characteristics. What we found was that CD2 marker, CD2 expression was associated with abnormal non-complex karyotype, with TP53 mutation, and with adverse risk according ALN 2010 classification. Both CD2 and TdT markers were associated with NPM1 wild type. We didn't find any association for CD4 and CD7. We also found that CD2 and TdT were associated with significantly lower complete remission rate. In contrast, CD4 was associated with a significantly higher remission rate. For CD7, we didn't find any correlations. In the second part of our study, we analyzed the association of a T-cell marker expression with survival measures. We found that CD2 and TdT were associated with significantly lower event-free survival. For example, TdT event-free survival for patients with higher TdT expression was 11%, 2-year survival, and for patients with low TdT expression, 37%. And the significance was the p-value was very significant. We also found that TdT expression, the patient with high TdT expression had a lower relapse-free survival, and we found that CD2 expression was associated with trend to lower overall survival. And also, we didn't find any correlation for CD4 and CD7. In conclusion, I want to say that we found like previous studies, that selected T-cell markers are associated with adverse cytogenetic and molecular characteristics of patient, and with poor response to induction treatment and with adverse outcome. Further studies are needed to evaluate and better characterize, molecularly characterize the subtype of disease and possibly find new targetable pathways of treatment.